Healthy Direction, sponsored by Compass Fat Loss.
Thank you so much for joining us for Healthy Direction, where we educate and empower you to live a healthy life. And part of a healthy lifestyle is getting to a healthy weight. And joining us today to share some insight into how you can achieve and maintain your weight loss goals, Dr. Kusher from Compass Fat Loss. A pleasure.
Hi again, Maggie.
As always, great to have you. So I want to kind of get right into it because we know that a healthy weight leads to overall better health. But let's talk about the facts and what you've observed among your patients. What is the connection between the right weight and good health?
Sure, there's a direct correlation between obesity and general health markers. So, we have patients that come in to lose 20 pounds. We have those that are on a bunch of medications and need to really lose a lot of weight. It's those patients that really need our care the most. They come in with diabetes and hypertension and cholesterolemia and different metabolic type diseases that are coincident with the overweight. So my focus really is to actually get those health markers to improve, and the weight loss almost comes along as a side effect.
Right. What kind of results, what kind of improvement have you seen among your patients as far as their general health goes as the weight is coming off?
Well, if we break those down, most diabetics, believe it or not, insulin dependent or not, they'll get off insulin in a matter of weeks as their progress goes down. They'll get off oral medications just after that. People that are on blood pressure medications will get them chopped down incrementally until often they're gone. Same thing with cholesterol, those dependent upon blood tests a little bit down the road. The important thing is that we co-manage this whole process with the patient's primary care doctor or specialist, so they have a team that's monitoring them and everybody's doing their part.
And I think the good news kind of keeps on coming here when you're trying to hit that perfect weight for you. But have you seen a positive impact for chronic conditions that maybe patients have been battling for years?
Oh, sure. I mean, they range from arthritis and joint pains, which go away for some obvious reasons, the reduction of weight on the joints and the lowering of the inflammation in the body. We see patients that come in with their complexions improved.
Wow.
We see patients that sleep better and actually get off of CPAP machines that they were using for sleep apnea. It's crazy what happens that I least expect sometimes.
It's amazing to have these delightful surprises along the way.
It's a labor of love.
Now, I know that, diet is a big factor here, part of the equation, but how important is exercise? You got to start moving, right?
You do, and it's responsible for really 20% of all the progress. But we ask our patients to exercise lightly, if at all, during the first 6 weeks, because that's when we're making the metabolic changes.
Okay.
And intense exercise can interfere with that. Then we do DNA testing, and we get really specific, and we build out exercise and nutritional supplement programs for them based on their genetic structure.
Wonderful. Dr. Kusher, a pleasure.
Always.
As always. Thank you so much, and thank you for joining us. And remember, if you have any questions or any additional information, you can visit compassfatloss.com. Plenty of important tips for achieving that weight, that healthy weight for you next time. For now, for Healthy Direction, I'm Maggie Slysz.
Healthy Direction has been sponsored by Compass Fat Loss.